Hi, I'm Dr. Kristen Marvin. I'm a licensed psychologist in California, and I have a couple of private practices where I meet with people the old fashioned way in person, but I also do the new age online therapy as well. So, I wanted to outline a couple of advantages and disadvantages of online therapy because it is a new and upcoming thing, and there's some controversy around it. So, some of the advantages are that anybody can meet with a therapist if you have access issues, mobility issues, mental health issues that don't allow for you to leave your home. If you're living in a really congested city, you don't have to fight parking and traffic and all of that sort of stuff. So it's really helpful for the most part for the access issues. Some of the slight disadvantages are that you may actually never meet with your therapist in person. Some therapists can offer hybrid appointments, so some in person, some video, but for the most part, your therapist probably doesn't even live in the same city, maybe not even the same state or even country as you do. As long as they are licensed in the state that you're in, everything's good. Some insurance companies won't cover online therapy, so you'll have to discuss that with them. One of the bigger issues, I think, is just that of Wi Fi. This is obviously how you're connecting to your therapist is Wi Fi. So if you have slow or spotty Wi Fi, it may interrupt your ability to speak with them. But generally, in the first appointment, your therapist will go over the plan B. So plan A is everything goes smooth without a hitch and there's no Wi Fi hiccups. But in the event that something does happen, generally you'll switch over to another platform. You might switch over to a phone call, or you might have to reschedule depending on what's going on. So there are a couple of little hiccups that can occur that wouldn't normally happen in an appointment. The other thing is that if you have something going on that's crisis related, your therapist may not be able to actually respond in a proper manner. So that can help or that can affect the efficacy of the help that your therapist is giving you in therapy. But otherwise, it's a pretty similar situation where everything is still confidential. Your therapist is still meeting with you in a confidential setting, either their own private home where nobody can hear them, or the office that they see their regular not inpatient, their regular in person clients with. So they're usually still in a pretty confidential setting. And we just ask that you do the same too. So obviously it's difficult if you're in your home and you're taking care of your children, you can't keep them quiet. We understand those things, but just making sure that nobody else can hear your appointment so you feel like you can still get the most out of that therapeutic environment. So hopefully that helps you to decide what works best for you. And if you want any more information, have any questions, you're more than welcome to email me to ask those. And that contact information is at the bottom of this webpage. So hopefully that's helpful for you. Cheers.